Hi everyone, Doc Mitch here. I'm in the parking lot of Delgado and I just finished my clinic and I just thought of making a video now, a very short video about heart health in women. Now, February has been tagged as the heart month. Okay, so what better time to talk about heart health for women? February 1 has been tagged as Go Red for Women's Health. Okay, so Go Red for Women is a campaign that was started to raise awareness that heart disease and stroke as one of the leading killers of women. Now, there are 5 facts that you need to know. First fact that you need to know. The Go Red for Women was a campaign started in 2004 by the American Heart Association to increase awareness about the signs and symptoms of cardiovascular diseases and stroke, and it also increases awareness of certain particular risk factors that you need to take note of. Now, what started as a simple campaign in the United States in 2004 is now present in more than 50 countries all over the world. The Philippines in particular celebrates this on the first Friday of the month of February, wherein all the doctors, the cardiologists, and all who support the campaign wear red in support of women's health. A recent report released actually reported that more than half of women all over the world have some form of heart disease. Maybe it can be actually attributed to the change in guidelines on the definition of hypertension, because in 2017 the American Heart Association lowered the threshold from 140/90 to 130/80. Okay. Third thing you need to know. Heart disease in women can present differently. Heart disease has been identified as the leading cause of death in women, accounting for 1 in every 4 deaths. In fact, more than 2/3 of women who die suddenly of a cardiovascular disease do not exhibit any symptoms. That's why all of us doctors, especially your cardiologists, stress the importance of screening for women despite the lack of symptoms, mainly because you may still be at risk. Fourth, okay, although certain risk factors actually affect both men and women, like high cholesterol and obesity, there are certain risk factors that may affect women more. The factors that can disproportionately affect women are the following: mental stress and depression, smoking, inactivity, menopause, broken heart syndrome, and pregnancy complications. Now, these risks can actually create a greater toll on the woman's heart compared to the man. Now, this is maybe because patients or women are more emotional, so medyo mas dinadamdam nila ang mga breakups, or they actually, basically are the shock absorbers of a lot of the problems in the household, so they become depressed because people tend to confide in them, but at the end of the day they don't really have anybody to confide to. So for all the family members, keep the avenues of conversation open. Mom is not as resilient as she is, so if she needs to talk to somebody, be that person. Alright, so number 5, you need to lower your risk. Okay, although there are some risk factors that are out of our control, like our age, our gender, our race or ethnicity, and your family history, there are certain steps that you can take to lower the risk of having a heart attack or having cardiovascular diseases and stroke. Namely, number 1, you need to keep your blood pressure in check. So try to monitor your blood pressure in the morning and in the evening, or at least twice a day. So upon waking up, so rest for about 10 to 15 minutes, then take your blood pressure. If you're taking it with a cuff, then you can actually just take 1 reading. Just make sure that if you're using a digital BP apparatus, make sure that your battery is always fresh. Kasi pag low bat na yan, may errors na sa reading. If you're using a wrist device to monitor your blood pressure, it would be good to take 3 readings and take the average. Okay, so in the evening, you can actually, when you're about to sleep, you can rest for about 5 to 10 minutes, then take your BP. Then just make a list of this, and then when you have your checkup with your cardiologist, show him or her the list of your blood pressure monitor. Next, you keep your cholesterol low. So very important that you actually modify your diet. You can actually convert to a low-fat diet. And then if your cholesterol is high, your doctor will be giving you medications that you need to take to keep your cholesterol in control. So do not forget to take that. So it's very important that you have to have at least your yearly laboratories to monitor your cholesterol, your blood sugar, your SGPT, SGOT, BN-CREA, uric acid, the complete workups. It's very good to have it at the start of the year, so you actually have a baseline every year. So it's also very important that you have your regular checkup with not just your OBGYN as a woman, but you also have to have your checkup with your general doctor or your internal medicine doctor or your cardiologist. Third step, quit smoking. If you're smoking, quit now, okay? Or at least gradually decrease your smoking habits, okay? Fourth, exercise regularly. 3 to 4 times a week of 30-minute cardio workouts can actually be very, very helpful, okay? And last, fifth, get ample sleep. Ample quality sleep. It's very important that you get at least 6 to 8 hours a day. Please do not binge too much on Netflix beyond 12 a.m. So we're not getting any younger, so it's very important that you get quality sleep. And then adequate sleep is very important because a lack of sleep may actually make you more prone to developing high blood pressure, obesity, and diabetes. Okay, so with that, take care of your health, take care of your heart, get checked today. Bye! God bless you! Stay safe!